It's really essential that we invest in healthcare. It implicates everyone, no matter what stage of life. And of course, for those who are over a certain age threshold, health expenditures can be very significant. At the moment in Ireland, we have a two-tier health system, which effectively discriminates on the basis of ability to pay. People pay thousands of euro each year for various types of private health insurance packages, and these cover some of the cost, and they do give some preferential access to treatment and diagnostics, something of course that's completely unfair and not in keeping with the ideals of a republic of equality. A commitment was made back in 2017 by a cross-party Oireachtas committee to reform health and to create a single-tier health system, not unlike what exists in many other European countries. Little or no progress was made. Why is this the case? I suspect it's less to do with money and more to do with vested interests in terms of various groups providing services, and also in terms of the bureaucracy that has increasingly centralised the health service and that prevents all effective reform. Right now we are facing into a clinical winter, as it's called, and what this means is that frontline services and staff will be under incredible pressure in the coming weeks. This is going to be compounded by an idiotic pay and number strategy imposed by the government, by a Fianna Fáil minister and a Fianna Fáil Fine Gael government in the main, on a health service that is already creaking and not able to deal with the demands from both the rising population, but especially an ageing population. The number of people over 65 has doubled in the last 20 years and will probably increase dramatically further to about 25% of the population by mid-century. That means we need to rethink the way we deliver and fund health services. Something that is of crucial importance is community health and the supply of GPs in our cities and rural areas. In Kilkenny City, for example, it's next to impossible to get registration with a doctor if you arrive from outside. Many people have told me that they travel, in one case, back to Dublin to go to a GP because they simply cannot get a GP in Kilkenny City. The problem is, if anything, worse in some rural areas. We need to invest more in community health to ensure that we take some of the pressure off our acute hospitals. And finally, we need to ramp up investment in mental health to reach a target of 10% of our overall health budget, so that people with challenges in mental health are able to access the right services at the right time in the right place. Healthcare should be top of the priorities for the new Dáil and for the new government. And if elected, I will work hard to make sure that we both reform and fund health and move towards a single-tier health system. Gar Mohammed.